Hi everyone, this is Rick MacDermid here with Senior Solutions Group, and we help people with Medicare retirement planning. We love doing it, by the way. If you haven't subscribed to our channel yet, please do so, and let's get started. Those of you who are on Medicare or getting ready to go on Medicare, be braced for big changes. Some of them are good in 2026. One thing that you'll notice if you're on Eloquis or Xarelto or a number of other high-end, very popular drugs, there are a list of 10 of these drugs, the prices will be reduced by about a third or actually 2/3 next year, depending on the drug. Back in just a couple years ago, the prescription drug plans, now there are two different types, two different categories. You can be on a standalone prescription Part D drug plan. So that's for people who have original Medicare, not on a Medicare Advantage plan, which is an alternative plan. It's a private plan for people with Medicare. So on that plan, you don't use your Medicare card. You get a replacement card from an insurance company. Those of you who are on traditional Medicare, many times you might have a Medigap or a supplemental plan in addition to Medicare, will have a third card, which is a standalone Part D drug plan card. In 2023, the insurance company only had to pay 15% of the cost of the drug once you went into the catastrophic phase. The government, Medicare, paid 80%, and you would only pay 5%. So if you were on 2 or 3 of these high-end drugs, you would have a deductible period where you would pay 100% of the cost. Then the initial coverage period where the plan would pay 75% and you would pay 25%. Then you'd have what was called at that time the coverage gap, also known as the donut hole, where the member would pay 25% and then the drug manufacturer would pay 70%. And then the Part D plan would pay 5%. Then you go into the catastrophic phase. So these are people that are on, again, very expensive drugs. Maybe it happens in the month of August or maybe even April. You enter into this phase, well, the insurance company only had to pay 15% during that phase. And Medicare, CMS, paid 80%. So the insurance companies really weren't dealing with a big risk for the most part. Fast forward to 2024 and now 2025, look what's happened. The script has been flipped. The insurance companies now, instead of paying 15%, are now paying 60% for those high-end drugs. And the government, Medicare, is paying 20% instead of 80%. So the government has shifted the risk from them, the taxpayers, to the insurance companies. Where's the money going to come from? Now you notice the other 20% is covered by manufacturers and discounts in 2025. So there is some relief with these prescriptions, these first list of 10, the Eloquises of the world, the Xareltos of the world, that are going to cost less next year. So the insurance companies aren't going to have to pay as much for those drugs. Now what we're seeing is providers are prescribing a lot of these diabetic drugs for weight loss, such as Ozempic, which will be on the list for 2027 for a reduced cost. So the insurance companies are bearing the brunt. They're having to be very, very meticulous about what drugs they're going to cover moving forward. So it's very important that you review your drug plan in 2025 between October 15th and December 7th for the year of 2026, because you want to make sure your drugs are covered. Now, by law, that small subset of drugs, the 10 drugs that are negotiated to go down in 2026, must be covered by all plans. Well, look what's happening here. In the year 2020, in our state, in Washington State, there were 33 drug plans. Now we have 10. The most drug plans that are offered across the country are the purple states, which have 12 drug plans. So we have gone down by about 2/3, maybe 3/4 the amount of plans. A huge, massive reduction of insurance company offering Part D drug plans. We're seeing massive consolidation as companies leave the business because they're not going to deal with the Inflation Reduction Act anymore. They got out early because they saw the writing on the wall, or they are either raising their premium Now, there is a provision where the plan can't raise their premium more than $50 for 2026. Now, in some cases, we're seeing plans that have a zero premium, which may work for people that take very few drugs or maybe take a couple generic drugs. It's very important, though, to just not assume that the plan you're on now is going to be the best plan moving forward. So what I would advise you to do is to either go to Medicare.gov, Medicare.gov. It's a lot more efficient than calling 1-800-Medicare. You can reach out to your agent. He may not or she may not have the time to help you because they're going to be flooded with taking care of other clients, or they may decide that they're not going to offer Part D assistance anymore because for the most part, the prescription drug plans are no longer compensating agents anymore like us. So this is a service we're going to continue to offer for our existing clients who have their Medicare book of business with us. If you don't have an agent and you would like to look at your options and you're considering moving your book of business to another agent, feel free to reach out to us at Senior Solutions Group. Or if you want to do it yourself, do yourself a favor, go to Medicare.gov. You can log in if you have an account. It'll pull up the last 12 months of your medications, and you can edit your medication list, put in your pharmacy, and then it'll show you which are the top plans in order based on the drugs that you have in the system. Or if you don't want to create an account, you can just enter them in manually and then put in your pharmacy manually, and it'll still show you the same lineup of plans. Do yourself a favor. Medicare supplement plans are going up in price. You don't want to have to pay double to have to pay more for your prescriptions when everything else is going up. Again, we are Senior Solutions Group. We are here if you need us, and have a great rest of your day.